When I got diagnosed, I was like about a year old. My parents always tell me a story. I asked them, and they just told me how they found out because my aunt decided to cover my left eye, and I started getting scared because I couldn't see. Then they found out I had cancer in my right eye. And when I was a year and a half, I got surgery.
Unfortunately, a lot of these patients, when they reach adulthood, come down with health problems that they're not expecting.
It was clear that special clinics or special doctors needed to evaluate these patients and help them get to the best health. But where they would go or who would do that was totally unclear. But we were excited to open a clinic that would be available to anybody in the Chicagoland area that had childhood cancer. When I first went into pediatric oncology, the idea was, will my patients live or die? And nobody really talked about the idea of survivorship.
So what our clinic does is 3 years after they have finished therapy, they may be seeing Dr. Schmidt, but then they also come to our clinic so we can do a very thorough evaluation.
We were inspired to give this gift to the Childhood Cancer Survivorship Program at UIC because we received a generous gift from my parents, and we were thinking hard about how to use it. It was fairly easy for us to conclude we wanted to support the UIC Childhood Cancer Survivorship Program, and through other generous donors and matching opportunities, we've been able to expand their original gift several-fold.
After getting this funding, we were able to increase our clinics to once a week. We now don't have a wait list at all, maybe 2 or 3 weeks for a new patient appointment. I was able to be hired as an advanced practice nurse, so I can also see patients. So now we have 2 providers. The funding is also supporting our social work position. It allows her to dedicate time to our clinic and our patients.
It seems like University of Illinois Chicago is providing care to the more people in need than pretty much any hospital in the city. And so I think the inspiration should be, why don't we put the money where it's needed most?
So the clinic serves all members of the community. It doesn't discriminate based on insurance coverage. It doesn't matter if you have Medicaid. It doesn't matter if you have county care. We're able to see you and take care of you and make sure that you get the care that you need.
Ever since I heard of UIC as a school, that's been my one goal, to get into it. And now I'm studying my 3rd year in psychology. Even if I don't get to medical school, I want to do something close to medicine. I want to be able to help just like those people that helped me. I would thank Dr. Schmidt because she's always been there for me. Every time I go in for a checkup, it's like seeing like a person that I know I'm secure with. Now the fact that there's a survivorship clinic, I know that that's gonna help a lot of people be able to support themselves when they feel like everything is falling on them.